This is Michelle Sullivan with the Global Medical News Network, reporting from the summer meeting of the American Academy of Dermatology in Chicago. Advances in neonatal care continue to improve survival in premature infants, but these very little babies still face some very big challenges when it comes to skin infections. Dr. Lawrence Eichenfield tells us why and what pediatric dermatologists can do about it. Dr. Eichenfield, these very premature babies are subject to picking up some opportunistic infections when they're in the PICU, is that right?
Yeah, so what happens now, neonatal care has changed and our ability to support premature infants is better than it used to be. A consequence of that is that premature infants are really being supported when they have incredible skin immaturity. And the skin immaturity creates problems: temperature dysregulation, loss of fluid through the skin, so fluid electrolyte imbalance, but also a much greater tendency to develop opportunistic infections. And we now have outbreaks of localized opportunistic cutaneous infections with fungi and yeast in neonatal units. It's important for people to know that these can be very subtle in presentations. They can be papules, pustules, ecchymoses, or crusts. And these are what I call outside-in infections. So these opportunistic yeast and fungi and molds can be localized skin infections. If caught early, they can be treated and the child saved. On the other hand, if these fungal infections make it into the bloodstream, then they will seed other organs, such as the brain, the lung, and the liver, and they have a high mortality. So the good news: better neonatal care allows better outcomes, but as physicians we have to be aware of the findings that can be rather subtle of opportunistic fungal infections, so we can do early evaluation, early biopsies, which are readily indicated for these abnormal presentations, and then early institution of treatment, which can be truly life-saving.
This is Michelle Sullivan with the Global Medical News Network.